Goodbye.
Okay, good afternoon, everyone. My name is Lauren Kleiman, Mayor of Newport Beach, and I am filling in for Mayor Wendy Bucknam to run today's meeting. I want to welcome everyone for attending. And of course, thank you for your continued commitment. Please
Is anybody on Zoom?
mute yourself if you're online. Again, I want to thank everyone for your continued commitment as we collaborate on policy reforms that address resident concerns regarding the operation and existence of sober living homes and treatment homes while ensuring those seeking treatment receive quality services in an appropriate setting. As a reminder, this meeting is public, streamed live to residents and press, recorded, and will be made available on our website, www.soberlivingtaskforce.com. As many of you know, one of the purposes and benefits of the task force is to serve as a hub of information and collaboration for jurisdictions, elected officials, residents, and stakeholders across California. So getting into our agenda for today, I'm going to just give a brief update on our legislative ad hoc meeting. We convened right after the bill deadline. I know we're going to be hearing in more detail from each of the legislators' offices, hopefully all of the participants of the call, and they can provide a little bit more on each of their respective bills. But it's been great to see the continued and new bill activity again this legislative session, all in advancement of more education on this issue. And again, we are so appreciative of the legislators who have been supporting us on this issue and all the work that's being done to advocate on the issue in the region and beyond. Some of the things that are coming back from last year are SB 35 and SB 329. I know those have new numbers. Again, we'll be hearing about those bills in a moment. And Assemblymember Davies' AB 1779 is new this year. And Assemblymember Dixon is sponsoring AB 2614, a bill that would address the inability to enforce ECRA, Eliminating Kickbacks in Recovery Act, that was raised by the insurance fraud investigator who presented to this task force last year. What's also new this year is some engagement from the healthcare plans, which we've been seeking to get for some time, hoping to build on that. And once again, we need all of you to reach out to your representatives and ask them to support these bills if we're going to get any traction this session, especially some of our new additions outside of Orange County. Moving on to specific legislative updates from each of the offices. We'll start with Caroline Grinder from the League of California Cities.
Hi, everyone. Can you hear me okay in the room?
Yep.
We can hear you.
Okay, great. Thanks for letting me do a quick update. As previously mentioned, Cal Cities is sponsoring two bills this legislative session related to this topic. The first is SB 490 Umberg. That's a reintroduction of SB 35 Umberg from last year. That measure would require the Department of Healthcare Services to meet specific timelines for investigating allegations of unlicensed treatment services happening in sober living homes, and would allow counties to conduct investigations into those allegations if the department fails to meet those timelines. We've been at this concept for a while now. This bill moved quickly through the Senate at the beginning of this year and is now over in the Assembly and will move next couple of months. Eager to continue to push this idea forward and really get the Department of Healthcare Services more involved in providing oversight of sober living homes that are accused of violating licensure law. The other bill is, as previously mentioned, SB 329 Blakespeare. That bill is similar. It implements timelines for when the department has to investigate allegations of complaints, but this is specific to those licensed facilities. 490 has to do with our unlicensed sober living homes. 329 has to do with our licensed alcohol and drug treatment facilities and having some timelines there. This is all in response to the state audit that found the department was taking well over a year in some cases to respond to some of these complaints. SB 329, we're actively working on amendments right now with the Department of Healthcare Services. We had to hold the bill last year because they raised concerns that it wasn't implementable. So we're in active conversations with them right now about how to move a version of this forward that continues to keep the pressure on the department to provide adequate oversight. So that's in the works and should be moving sometime before June. Other than that, those are the only two Cal Cities sponsored bills. I did want to flag just for some awareness, something that Cal Cities hasn't taken a position on yet, but something to keep an eye on. Senator Valadares, she's vice chair of the Health Committee. She's introduced one spot bill, which means there's no language in it just yet, but it shares some intent. And then another bill, both related to this topic. And so that's great. She's vice chair of the Health Committee where all these bills go through. She's from the Palmdale, LA area. So also kind of outside of Orange County, which I know is something this group has worked really hard to kind of spread our influence to other areas. So just something I wanted to flag. We don't have a position yet. We're still diving into both of those, but want to make sure those are on our radar. Those bill numbers are SB 1060 and SB 1354. So that's it from me. Happy to answer any questions on Cal City sponsored bills, and I'll kick it back over to the group.
We'll now move to Hunter Griffiths from the Office of Assembly Member Dixon.
Good afternoon, everyone. Thank you so much for having me. Assemblymember Dixon does have two bills that she has introduced so far on this issue. One I'm just going to briefly go over, and then the second one I'll cover a little bit more in depth. The first one is AB 1879, which is sober living success reporting. This just requires reporting of data related to success of rehabilitations of patients in sober living homes. So that just continues to kind of build on what we work on here to increase reporting and accountability and promote the successful practices that do exist within this business while rooting out kind of the bad actors, which is more of what the next bill addresses in AB 2614, which was sponsored by our good friends in Newport Beach. This is the Body Brokering and Patient Referral Integrity Act. And what this mainly hopes to do is it prohibits any person from paying, soliciting, or receiving a commission, benefit, bonus, or rebate to induce a referral to a residential treatment facility in exchange for accepting an individual into that facility. It also makes it unlawful to aid, abet, or advise prohibited conduct. It defines residential treatment facilities to include licensed and unlicensed facilities, and it establishes that a violation of these provisions is a misdemeanor. And so the goal is hopefully by making this a misdemeanor, it's going to kind of incentivize some of the districts and some of the different law enforcement groups to enforce these laws and kind of root out the bad actors and hold them accountable for behavior so we can not promote it going forward. So if you guys have any questions for me, I'm more than happy to answer what I can. I also know that Ryan McCarthy with Townsend has been working very closely with our Sacramento staff on this bill specifically. So if you have any questions that I can't answer, I hopefully he can kind of give us some more insight on it. I've also going to comment below our legislative director, Bennett Simpson's information. So if you have any questions or if you want to just stay updated with that, you feel free to reach out to me or him going forward. So thank you.
Thank you. And we'll actually hear from Ryan after we hear from Assemblymember Davies' office. Is Daniel on the call?
Yes.
Yeah, good afternoon, everyone. My name's Daniel. I serve as a legislative assistant for Assemblywoman Davies. The Assemblywoman has introduced one bill this year regarding, substance abuse treatment. It's AB 1779. Our goal is also to kind of put an end to patient inducements, incentivizing patients to come out here and then end up staying out here. So AB 1779 is going to bar laboratories, treatment facilities, programs from offering stipends or other payments to influence individuals to enroll or remain in treatment or recruit others. We are going to establish stricter rules for transportation assistance. So transportation is going to be for treatment only if it's limited to their actual costs, not if it's going to be tied to program participation or insurance benefits. Um, we're going to require round trip airfare if facilities are flying in patients. We want to make sure that those patients have a time, a date, and a way to get back home. We don't want any more patient curbing, right? So the main goal is to get them their treatment and get them home. So we are also creating transparency and adding reporting requirements. So we're going to ask facilities to compile. We're not going to ask them. We're going to mandate facilities compile transportation data, publish their aggregated information annually on their website, and then retain those records for 5 years. And that's, again, just for transparency so that us and you guys down in the cities know who's coming in, how many people they're bringing in. And then we want to make sure that information is retained so that if you guys ever need it or if the state needs it, then they will be required to provide it upon request. The bill, we are still working on some of the language. We're talking about adding some teeth to it for facilities that are found to be in violation of this bill. So we got some cleanup language other than that. And the bill, as of now, will be heard April 7th. So just after the spring break. And I will also be putting my email address down in the chat. If anybody has any questions, concerns, or follow-up, please don't hesitate to reach out. I'd be more than happy to talk further about this bill. So thank you very much.
Thank you, Daniel. And again, I'll just cue Ryan if you have anything to add on Assemblymember Dixon's bill or any of your conversations that you've been having with legislators that might be helpful for the group to hear.
Absolutely. Thank you, Mayor Kleiman. I appreciate it. My name's Ryan McCarthy with Townsend Public Affairs. I've had the pleasure of working with the city of Newport Beach on their sponsored legislation, AB 2614, which is running through and being authored by Assemblymember Dixon. We do have a broad coalition of support across Orange County for this bill. Senator Strickland, Senator Choi, Assemblymember Davies, Assemblymember Ta, and Vice Chair of the Assembly Health Committee, Philip Chen, have all signed on to be co-authors. We've continued to engage with the committee staff and stakeholders to determine the prospects of this bill and what the recommendation might be once it is referred to the health committee, just to try and stay ahead of that. But the big thing right now that we're really trying to do is drum up support for the bill, and I think that's why this group is so valuable. I'm not sure if you all have been circulated the draft letter of support that I've written, but if you are in support of this bill, if you think your city would be in support of this bill, I would highly, highly recommend reaching out to me or Jeff or anyone on the task force team to get a copy of that letter, and we can and take that back to your city to have it signed. The more support we can have for this bill, that's going to be the biggest thing. And like I said, I think that this group is really valuable because we are engaging cities and organizations from across the state. So the more support that we can show for this bill when it comes up for a hearing in the Assembly Health Committee, that's what's going to really be the difference in getting this bill across the finish line. I know you all have been very engaged on this issue of body brokering and the broader issue of sober living facilities for a long time now, and I think that this bill represents the step in the right direction that we want to see by giving locals a bit more enforcement over these homes while also or over the practice of patient brokering, excuse me, while also protecting the patients that are in these homes who are being subject to this borderline human trafficking treatment. I'll also put my contact information in the chat down below. So if anyone has any questions or wants to reach out for additional information on this bill or the draft support letter, I'm happy to share that with anyone who's interested in signing on and support. So if anyone has any questions about this, feel free to fire away.
Thank you, Ryan. Yeah, just another emphasis, again, if you're a resident who's online and listening, we need you to reach out to your representatives to make sure that they understand that this is an important issue that that we do need some change on. So is there anyone else? Do we have anyone else on the online that wants to speak at this time? Okay. Moving on, I'd like to welcome Jeff Corliss from Venture Strategic, our task force consulting and management team, to provide an update on outreach and research initiatives, including any progress on public awareness, studies, or stakeholder engagement.
Great, thank you, Mayor Kleinman. Just real quick for those that are paying attention to legislative advocacy, one of the things that we will reactivate on the soberlivingtaskforce.com website is the advocacy tool that we had up last year, which will show all of the active bills so that you can easily click within just a matter of 3 clicks, a support letter that is generated that you get to sign and is submitted to our team. And our team, as these bills start to get assigned hearings and we're building up support for them, those letters get captured on a daily basis. My colleague Peter Dorsch and his team will upload those into the legislative portal that then automatically distributes them to each of the committees and the appropriate staff that are looking at who is supporting and opposing a bill. It's a much different system than used to exist, where you would send it to your legislator or to the members of the committee. It goes through a portal. It's a bit of a challenging process. So to make it easier for any jurisdiction, you just get it to us and we load it for you because we've got the whole account set up. It takes longer to set up an account than it does to submit a letter. So
yeah, no, I'm glad you mentioned that. Just quickly on the website, I know we have a lot of testimonials that we've collected. Are we housing those for people, particularly legislators and their staffers, to go to the website?
yeah, they're on the website.
They are? Okay.
They are.
I remember scrolling through there and I saw a few, but it wasn't immediately obvious where to find the rest of them.
So we recently updated the website
Okay.
and overhauled the organization of the material and made some updates to it. So there is a whole videos and testimonials section on there, Mayor, that consolidates all of those into one space. So we'll highlight that in the next recap email newsletter that goes out so people can directly click to it or at least know where it is.
Great, thank you.
Regarding research, as you know, Mayor, you've participated in these meetings. We've had 2 meetings recently with the University of California, Irvine. We met with Dean John Gold of the School of Social Ecology, as well as Dr. David Richardson, who is the Associate Dean of Research for the School of Public Health. So we're working with UCI to develop a research package that allows us to capture empirical data and evidence to support all of the legislative reforms that are currently being proposed and future legislative reforms. And the goal is really to have that scientific research beyond the anecdotal research that we have utilized in the past to support legislation and other reforms in local government. So over the next 30 to 60 days, we'll be working with Dr. Richardson to finalize the design and structure of the research, both qualitative and quantitative, and determine the necessary resources to fund that initiative. One of the 6 strategic initiatives for 2026 approved by the California Sober Living and Recovery Task Force Board of Directors was to conduct research. So that's a big part of our effort this year to strengthen and fortify the data that persuades our legislators in Sacramento to unite behind these reforms. One important element of that is taking inventory of the current data that we have available to us, the sources of data sets that could be analyzed and drawn from for the research. For example, law enforcement data, county health data, which Supervisor Foley's office is helping us with insurance claim data now that the health insurance industry is starting to engage more in this, and other data sources, and of course, willing participants from operators. At our last task force meeting, we had an operator who participated and talked about how they deliver service and engaged in a candid dialogue with you, Mayor, and other elected officials that were here, and it was very productive. So we're going to look to those operators who want to participate in this process and be good actors and draw them in and ask them to willingly participate in supplying data on outcomes that certainly are HIPAA protected, but handled in a compliant manner so that we can inform the research and give real data to our legislators on patient outcomes. Any questions regarding the research?
No, I am glad to see that moving forward. As many know, we've been trying to figure out how to build on the audit that was done a couple of years ago now, trying to really gather information, as you said, to demonstrate that there are a number of issues in this industry, and this is a great partnership, so I'm really excited about it. And I just want to thank you. Anything more you wanted to add on that?
Just a quick update on outreach as well. Oh, yes. So I'll include that in the outreach. So expanding the task force, Mayor, especially to jurisdictions throughout the state, not just Orange County or even Southern California, but also Northern California and other regions where we see high concentration of sober living and recovery homes, which we were informed of those high cluster areas through the audit that was completed. We appreciate Assemblymember Dixon's work on that and the state's work on that. It's critical for us to draw more people in and more active participants from those regions to broaden our bipartisan support efforts for bills that are being introduced in the legislature and other reforms. We now have hundreds of contacts in the task force's email system. And our team continues to extend meeting invites to many elected officials in city, county, and legislative offices to participate. We keep them informed. There's a lot of people that do participate in receiving the emails, but may not be able to attend every meeting. But one of the things that Mayor Kleinman will touch on as well is the personal requests for task force members and task force support. And we really need the existing relationships that all of our elected officials and representatives have to activate those they're close with to come in and participate. That's really going to be one of the most effective ways for us to engage folks. And to support those efforts, we've finalized a task force prospectus, which we have hard copies here for those that are in person. This talks about the effort overall. It's got a cover letter from Mayors Bucknam and Amesqua, who co-chair the board of directors, Mayor Bucknam, who co-founded the task force, as well as the strategic initiatives that have been approved by the board. There is an approved budget in that, and as each initiative has a specific plan around it, we're presenting that to participating jurisdictions to request funding support into the nonprofit board, which is overseen by the elected officials that sit on that board, as well as administrative oversight provided by the Association of California Cities Orange County. And in addition to that, we're working with Mayor Bucknam to identify an opportunity for the task force to present to the Southern California Association of Governments, and we will continue to seek to identify similar opportunities for other mass exposure with organizations like the California State Association of Counties, and certainly we're working with the League to get this message out to the other regions besides just the Orange County region. So we want to ask our elected officials to commit today to someone specific, an elected official, a mayor, a supervisor, a council member in a neighboring jurisdiction, or one in which they have a close relationship, We have a sign up here. We'd ask if you're here to do that in person, and if you're online, to put it in the comments. Our team is going to follow up with you to give you the resources you need to make that initial introduction. We'll do all the follow-up and legwork to pull them in and get them involved. We just need your personal touch. With that, I'd be happy to answer any other questions you have.
Thank you. You did all the heavy lifting for me. I appreciate that. So SCAG is engaging. They're interested in potentially allowing us to.
Wendy's trying to facilitate that.
Okay.
So we put a request in. Peter's working with Mayor Bucknam on that.
Okay, great.
So we don't have a commitment from them yet, but that ask is being made, and we're looking at CSAC engagement from the county representative here.
That would be great. I'm on SCAG as well, so I can help Mayor Bucknam push from my end. Anything from Supervisor Foley's office?
No, not right now. We appreciate following the state legislation and continue to do everything we can to support, and thank you for your work as well.
Is there anyone else online that would like to comment or hands raised? Okay, I will just, at the risk of redundancy, reiterate. Oh, you do have one comment. Okay, great.
It's more of a question. My name's Steve McNally. I'm a citizen of Costa Mesa, District 5, and for the supervisor, and also on an Orange County Behavioral Health Advisory Board. Every county in the state has a mandated legislated citizen board that includes 59 electeds. So if you want to get a story out, that might be a way to get it into the community. But my questions are a couple. One is this Medi-Cal and private insurance related, the body brokering, or is it primarily private insurance? Two, have you looked at all the data sets at the open data portal at the state? Because you can pull down updated information into a sort of a clunky Excel spreadsheet that you have to clean up. Also, Orange County, Riverside, Los Angeles, San Bernardino, those four counties are 45% of California, so they bring all the politicians associated with that as well. And then my last thing would be, given when the private insurance brought people, sued them and brought them, and then lower level body brokering people got off with like hand slaps. I think the community knows who the bad operators are. And I suppose you have a list of bad operators. So that's some common ground. Everybody wants to get rid of bad operators, but they're heavily funded. So, and some by Wall Street. So how do we as citizen people understand the different roles of people? And are any of these state laws require any kind of fiscal requirements that could allow them to be killed in appropriations? Or will they be able to clear without going to appropriations? Thanks.
Thank you, Steve. Nice to hear from you, as always. Let me see if I can try to tackle those in order. I think we'll start with your insurance question. Maybe either Ryan from Townsend or Assemblymember Dixon's office can speak to that. I mean, essentially, the bill seeks to enforce existing state law that precludes the remuneration for any referrals for this type of service. But I'll kick it over to one or both of them if they want to expand on that.
Yeah, and that was very well said, Mayor. Thank you for that description. And Steve, I just wanted to clarify, your question is, does the body brokering deal with private insurance? I'm just a little unclear on what exactly you're asking as how it relates to the insurance.
Is it primarily a private industry issue, or is it also in the public industry? I've heard both, but the focus has been in the high end private. But I've heard there's also body brokering in the Medi-Cal system, which is a different system, but it's still about 35%. It's the county operated system across the state, DMC ODS.
Yeah, so it's both. I think whenever there is insurance money involved, you do kind of you do tend to see people who are engaged in this body brokering practice, and it happens in industries outside of sober living homes too. I know I work with some other medical organizations who have said that this kind of thing happens in their industries as well, where people receive kickbacks for referring to acupuncture or
Right,
something, just for lack of a
right,
better example. But the main issues that I think we're seeing in California are with the private insurance. What typically happens with the body brokering is these unlicensed third party body brokers will find people who are on certain lucrative insurance plans, usually private insurance plans, and then get them and say, "Hey, I can help set you up in Newport Beach, right on the beach, and give you all these lovely
right.
amenities," which is what the Davies bill is tackling. So it's two-pronged approach in that regard. Um, but they're using these people who have private insurance and they're putting them in these homes. The homes are then exponentially overcharging people with these certain kinds of private insurance for services that most of the time they're not receiving. And because the homes are getting in some cases hundreds and
Yeah.
thousands of dollars from individuals off these insurance plans,
Could I stop you for
they're
1 second? I'm sorry to
yeah,
interrupt, but
no,
I'm
you're fine.
familiar with the problem. I'm just not familiar with when it took guys who were paying 80 grand a month to private insurance. It finally took the private insurance company to raise their hand, which is it took a long time. Uh, and people didn't get big sentences. I'm just wondering, how's your legislation going to change what already exists? Or you're creating another, I'll read it. I haven't read it, so I apologize, but I'll put it in my um, I monitor a lot of legislation across the state.
Mhm.
How is it going to help with getting treatment facilities to actually what's the mechanism that's gonna make them stop?
So it creates any engagement in the body brokering practice. It makes it a misdemeanor crime that is then
Okay.
enforceable by district attorneys and city attorneys. And there was
Okay.
a part of your question that touched on the fiscal aspect of this bill
Right.
and any issues with the Appropriations Committee, which is a very valid concern. When we originally crafted this bill, the goal, even though it does involve the creation of a new crime, the goal was to minimize the cost to the state as much as possible by allowing the district attorneys to be the ones who are prosecuting instances of body brokering. So in Orange County, where we've seen that this has been an issue in the past, the district attorney might want to engage heavily on this issue. In Shasta County, where I don't think this is happening very much, that might not be a high priority for them, and they don't really have to pursue it unless they want to.
But and I don't want to hijack your meeting because this could be a very lengthy conversation, but again, I'm just wondering, I'll read the bills first, but I didn't quite understand will it get hung up in appropriations or not based on the way it's currently set up? If somebody wants to kill it, will they be able to just kill it in appropriations?
Potentially. I mean, again, it's up to DHCS and the state agencies who will likely be seeing this bill to put their own price tag on it. Obviously, we'll advocate for it to not have a high price tag. But yeah, I would encourage you to read the bill and see what it does. And then, I'm also my contact information is in the chat. So feel free to reach out to me after you've read it, and I'm happy to have a deeper conversation on this with you.
Okay, great. Thank you.
Mhm.
Also, those suggestions that you had for additional engagement through those working groups or boards, I think should be shared with Townsend and others as well. So hopefully you'll connect offline did you also have a question about appropriations on the other bills? Because I think Caroline could speak to those, or was it specific
Well,
to
well,
this?
just in general, that hopefully they're designed to avoid getting killed in appropriations.
Oh, Caroline.
I mean,
do you
I
want
can
to-
answer.
Yeah.
Oh, yes. Sorry. Yeah, Steve, unfortunately, that is a real concern with most of these bills. If there's
Mhm.
if the bill has any impact on the Department of Healthcare Services and requires any increased spending from the department, so oversight, anything like that, it could be tagged with the fiscal, and that's where we've seen most bills stall. I mean, we've had
Mhm.
success getting past approps in the past, but it's a tough barrier for any bill moving through the legislature, and the state budget deficit doesn't make things any easier. So it's something we always have to think about and try to navigate around, but it's something that we do deal with on most of these measures every year.
And has Michael Hun got an opinion on these bills?
I think it's a great point you raise as these bills are now introduced and available. They, have they been presented to the Cal Optima Health Legislative Affairs team? That's something we could certainly help facilitate that conversation if needed.
I mean, he's going to retire, and he's worked private and public, so he'd be a good asset if he was predisposed.
All great suggestions. Thank you, Steve. I think we also have another hand up, Travis Kincaid.
I guess he took his hand down.
Oh,
He's okay.
okay.
Just you got to answer.
Okay, great. Anyone else before we move on? Okay, it's a short meeting today. I want to thank everyone again for staying engaged and for the thoughtful responses and questions. And once again, reiterate, please get your other colleagues or neighbors involved and engaged as well, because this is a collective effort, and all of our legislators need to hear from our communities and know that this is an issue that needs to be tackled. And so with that, I want to thank everyone. If there's nothing else.
Just a reminder to submit the specific elected official name that is your colleague that you'd like to bring to the next task force
Tag a
meeting.
friend. Give
Tag
us
a
their
friend.
information so we can follow up. Okay, wonderful. Thank you all again for attending, participating today. We will see. Do we have a next date yet?
I'll send it out.
Okay, we don't have a
In
date for the
June.
next meeting, but
It'll be in June.
stay tuned. In
The
June,
the meetings are now going to be quarterly.
quarterly. I think
so
that's
that-
great. All right, thank you again, everyone.
Something